Welcome to the Medical Oncology Rotation. The Medical Oncology Service is part of the IO, or Integrated Oncology Team, also comprised of the Surgical and Radiation Oncology teams. We are excited to have you on this new blended rotation. In order to ensure a healthy and safe learning environment, please observe the following precautions. Wear a mask at all times unless eating or drinking. Wash or sanitize your hands frequently. There are 2 sinks in the oncology treatment room and a number of wall hand sanitizers in or immediately outside the treatment area. In addition, stay 6 feet away from others when possible. Finally, please self-monitor for symptoms such as a fever or cough and stay home if you are feeling ill. There are 2 spaces that make up the Integrated Oncology Service. The larger portion shown here is the oncology treatment area or ward. This is where patients are examined and diagnostic samples are collected. Procedures may also be done in this room or in the smaller procedures room past the technician workstation. This is a communal space with communal resources such as the microscope, so please be sure to wash your hands frequently throughout the day. We will show you various parts of this space later in the presentation. The other space is the LCR, which houses computer workstations, televisions, and the appointment whiteboard. At the start of the rotation, clinicians and students will work together to assign workstations to each team member, either at a desktop computer or at the large table for those with available laptops. Workstations should be spaced to maintain a physical distance of 6 feet. If you are using a desktop, you will be limited to only using that computer, with the exception of the communal computer in the treatment area. We ask that you clean your workspace and computer with the provided hydrogen peroxide wipes at the start and conclusion of each clinic day. The LCR also has a refrigerator to store lunches. However, it has limited spacing, so you may also consider storing your lunch in the large refrigerators downstairs. Lockers are available in the LCR for storage of personal items such as lunches and backpacks. If your personal items do not fit in a locker, please use your student locker for additional storage. If you have not done so already, please visit the Oncology Rotation Carmen page to view your group assignments. To access group assignments, click on the Syllabus tab or red Syllabus button. Once in the Syllabus tab, click on the top link labeled Click Here to pull up an Excel document with group assignments. Students highlighted in scarlet are in Group A and will start their rotation on 7 a.m. on clinics. Students in gray are in Group B and will start their rotation at 8 a.m. online. Returning to the Syllabus tab, more detailed information about Group A and B schedules can be found by clicking on their respective links. This will pull up another Excel document which provides information about daily schedules. Online orientation and other discussions will take place via Zoom. The Oncology Zoom link can be accessed via several locations, including the syllabus, as well as the rotation homepage. The same virtual Zoom location will be used for all portions of the online rotation. Prior to the end of your first clinic day, please visit the whiteboards in the LCR and write down your cell phone on the whiteboard labeled student phone numbers. In addition, please work with your classmates in your respective groups to sign up for morning transfers on your group's designated clinic days. If you have not already done so, please sign up for the morning transfer email. A different student should sign up for inpatient duty on your group's designated clinic days. This is particularly important as students assigned to a given inpatient will change day to day. We recommend creating a group text message with both groups to communicate regarding inpatients, and we will also make an effort to discuss these patients during afternoon Zoom rounds. In the LCR, you will find the IO appointment board, which includes new appointments, rechecks, chemos, and radiation oncology patients. A list of inpatients can also be found. The service rounds on all patients at 9 a.m. board rounds. The board denotes the patient's appointment time, the assigned doctor, diagnosis, diagnostic plan, and treatment if applicable. For this rotation, our goal is to assign a student to a single clinician for each clinic day, and the assigned clinician will change throughout the rotation. However, there may be some days when you are working with 2 clinicians. You are expected to be involved in 1 new case and 2 recheck and/or chemo cases. These cases will be denoted on the whiteboard. It is your responsibility to be available during the designated appointment times. However, if you are unavailable, a doctor or technician may take in the case and round you after take-in. The board is generally written up the day before, which gives you the opportunity to review and prepare for your cases. We suggest that students start a group text message so they can share photos of the board and other relevant information for students on clinic the following day. Your primary opportunity for learning on this rotation will be with your new patients. There will be a student assigned to all new patients, and students should take a new case every clinic day. If there are fewer new cases than number of students, we suggest students pair up for new cases. Records for new cases will be labeled and clipped to the board for review. If you review the records, please be sure to return the record to the board prior to morning rounds at 9 a.m. You may read up on existing cases by opening the medical record and discharge summary, or by taking the chart from the chart rack next to the technician workstation in the treatment area. You may bring the physical chart with you when you take in a patient so the medical record, particularly previously prescribed medications, is readily available. Once you and the clinician no longer need the chart, it may be returned to the basket seen on top of the chart rack. All of the cases will be received in exam rooms in the front of the hospital. On your way to receive a patient, please take a clean leash from the oncology treatment room. Once the patient is discharged, leashes should be put in the green bin for cleaning. Prior to meeting your client in an exam room, please pick up the patient's paperwork at the front desk. The exam rooms at the front of the hospital are numbered, and the location of the client and patient will be noted on the paperwork. While in the exam room, please ensure that both you and the client are wearing masks, and be sure to maintain a physical distance of at least 6 feet. Please limit your history taking to 10 minutes. Prior to finishing with the client, be sure that you have a correct phone number at which the client can be reached. For new patients, we advise that the client stay in the area. Clients of recheck or chemo patients are generally given the option of going to work or returning home, if desired. Clients bringing in their pets for chemotherapy treatments may bring or be given an oncology drop-off form to fill out regarding their pet's condition since his or her last visit. If the client has not filled out the form, please review the questions on the form. Please also be sure to review current medications. If the client is unsure of their pet's current medications, this information may be found by referencing the most recent discharge in the physical chart or electronic medical record. Be sure to determine if the client needs any refills on medications. For patients undergoing anesthesia, a surgical procedure, an anesthesia consent form with a purple label at the bottom, must be signed prior to the client leaving. A signed estimate may also be required. This should be noted on the appointment whiteboard in the LCR, and the appropriate documentation should be clipped to the board. If you're unsure if or what papers are needed, please ask a technician or clinician on the case. When you're finished with the client and ready to take the patient back to the oncology ward, please remove the patient's personal leash, collar, harness, etc., and return them to the client. Use a blue slip lead to take the patient back to the oncology ward. Be sure to get a patient weight on the way back to the oncology area. Once you return to the oncology treatment area, please perform an exam on your patient with the assistance of a technician or classmate. Please be sure to record your physical exam findings, including weight and TPR, in the medical record and not just a personal notebook, so the clinician on the case can review this information. For new patients, after completing your exam, please develop a problem list, differential diagnosis list, as well as a diagnostic plan. This will be reviewed with the clinician on the case after they've examined the patient. You should be able to obtain a patient history, perform an exam, and develop a plan for your patient within 30 minutes. For recheck or chemo patients, please work with a technician or clinician to ensure that the appropriate diagnostic tests are ordered and collected. These tests should be ordered prior to moving on to your next case. To order diagnostics, you may use the communal computer in the treatment area. If you use this computer, please be sure to clean the keyboard and mouse after use. You are lucky enough to learn 2 different medical record systems during your clinical year. Regardless of the program used, it is important to input a complete and accurate history, particularly when submitting imaging, cytology, or histopathology requests, as well as consultations with other services. To consider what information might be useful in submitting a request, ask yourself, why am I requesting this diagnostic? Please pause the slide and read the importance of a clinically relevant history for requesting diagnostic imaging. Please ask the technician if you have questions about submitting requests for diagnostic tests. Large dogs should be housed in the runs behind the oncology treatment area. Please ensure that every patient has a cage pad, pink ID band, yellow cage card, and a bowl of water. Water bowls can be found at the sink at the far end of the runs. Small dogs or cats may be housed in Ward 1078A within the oncology treatment area. Barking dogs should be housed in Ward 1055 in the main hospital hallway to maintain a quiet working environment. If space requires, small dogs or cats may also be housed in the mobile cage banks within the ward. However, these cages should be prioritized for patients that need close observation, such as those recovering from anesthesia or sedation, seizure watch patients, or sick patients. Large runs across from the technician workstation are primarily used for housing of patients during sedation or anesthesia recovery. If you need to use these runs for other uses, please ask a technician first to see if there are alternative housing options. For patients spending most of the day in the hospital, it is your responsibility to take them outside to go to the bathroom at least once during their stay. Patients can be taken to the designated bathroom areas or to a grassy area, such as behind gauze. If you are taking a patient to an open grassy area, be sure that they have a secure lead and consider using 2 leads if needed. Please follow the Oncology Sedation SOP for sedation of patients. This SOP can be accessed on the Oncology Carmen page. Please note that an oncology treatment sheet, shown on the following slide, must accompany all sedated patients. A member of the oncology team, student, technician, or clinician, must be available for monitoring unless otherwise specified. Patients may recover from sedation or anesthesia in the aforementioned cages or runs and should not return to their original housing until they are sufficiently awake and alert. For a dog, this generally means that a patient is awake enough to walk to his or her cage. The oncology treatment sheet shown here should be used to record sedation drugs administered, including time and location of administration. In addition, the form can also be used to monitor and record vital parameters during sedation. Once you and your clinician have decided upon a sedation plan, we recommend filling out this form as soon as possible so it is available when needed. The completed form may be kept on the clipboard attached to the patient's run or cage. Whenever possible, we encourage students to be present for monitoring and observation of diagnostic imaging studies so they can improve their skills in diagnostic imaging acquisition and interpretation. You are responsible for completing your inpatient walk, exam, treatments, treatment sheet, and daily SOAP by 7 a.m. You may work on treatment sheets and SOAP the night before if desired. Student communication with clients generally occurs twice a day, once in the morning and once in the evening. However, please check in with the clinician on the case for more explicit instructions. Patients that are housed overnight outside the ICU should be moved to the 1055 runs, located in the main hospital hallway. Patients housed in wards other than the oncology ward should have a completed ward sheet. All information must be filled out, including a doctor's signature, prior to housing the patient in the ward. For patients undergoing anesthesia the following day, please be sure to mark when food should be pulled. The student or doctor on the case must round with the ward technicians on their ward patients prior to leaving for the day. Patients housed in the oncology ward that require treatments, such as intravenous fluids, IV or oral medications, must also have a completed ward sheet. This does not apply to routine chemotherapy patients, as their treatments will be recorded on oncology-specific treatment sheet. Patients housed in the ICU must have an ICU flow sheet filled out by 7 a.m. Please ensure that all patient medications required for the next 24 hours, up to and including 8 a.m. treatments, are available by ordering them from pharmacy or dispensing from Cubex. Please note that most of the forms shown in this presentation, in addition to other client and hospital forms, are available in the file organizer in the LCR. If a folder is empty or you are unable to find the appropriate form, please ask a technician for help. You are responsible for starting paperwork as soon as possible, and it is expected that the bulk of the paperwork is completed prior to afternoon rounds at 3. Paperwork should go home same day with clients unless otherwise specified by the clinician on the case. For new patients, there may be templates that can be built upon for patient discharge. To find a template, open Discharge Summary, click on New Discharge, and then you'll be prompted to select a template or blank discharge. To upload a template, scroll down to the SA or small animal oncology templates. You will find templates to the most common tumor types here. Clicking on Copy to New will auto-populate tabs within the discharge summary. In order to move through the tabs, you must fill in information at the top, including case number, appointment type, date admitted and discharge, and the name of clinician number 1. Filling out this information will allow you to view and edit the various yellow tabs. Please remember that templates should be edited to reflect an individual patient's case. For pre-existing patients, you may save time on paperwork by using the Copy to Current function. To do this, open Discharge Summary and click on Create New Patient Discharge Summary. Then select Blank Discharge. Once again, you will be prompted to fill out the required fields at the top of the discharge. Once these fields have been populated, click on the bottom tab, labeled Previous, and select the discharge from the desired date by hitting Copy to Current. This will copy the records into the various yellow tabs. Please be sure to edit the tabs to reflect the patient's current visit. In order to get a patient ready for discharge, the salmon color discharge form must be filled out and turned into the front desk. In most instances, the discharge will be reviewed over the phone, and the client will be checked out over the phone as well. The client will then be instructed to pull up to the front of the hospital where you or another member of the oncology team will release the patient. If the client is to come into the hospital for an in-person discussion, this should be noted on the discharge form. If you have any questions at the start of or during your oncology rotation, please do not hesitate to ask a technician or clinician. We look forward to having you on service, and we are here to facilitate your learning. Thank you for viewing this orientation video. Please enjoy this final slideshow highlighting patients from the Integrated Oncology Service, both current and past, and all adorable. Whew, I'm tired. That's a wrap. Cats rule.